not to listen to Boris or Denistos, as we call him, and just continue as we were doing. We haven't found that thalassemics are any more or any less susceptible to COVID than the general population. And even thalassemics that have been splenectomized, this is not there is no, even though you don't have a spleen, it doesn't mean that if you catch COVID, there is going to be a bad ending. So we've had about half a dozen thalassemics with diabetes, with various other bits and pieces, splenectomy, non-splenectomized, coming down with COVID. One of them had a kidney transplant about a week before they locked everybody down, and he was in hospital and he got COVID in hospital.
Yeah.
And he has recovered and he's doing fine. However, we have had another person who was very ill with kidney problems as well, and was in and out of hospital and caught COVID in hospital, and then sadly was on a ventilator and passed away. So, and these were both thal majors. We've had a couple of sickle cells and a couple of other, but everybody has recovered as far as we know.
Yeah.
And you all know that doctors aren't really talking about their patients and so on. So we're never going to get a full picture of how many people have been infected or anything like that for a while.
Yeah.
In terms of blood shortages, we don't have any blood shortages. We don't have any drug shortages or any treatment shortages. If we're having consults, they're done over a video link or a phone call. So that continues as normal. And in terms of going for a transfusion, where the units were, they were in the middle of the COVID wards. So we were pretty much walking around with a target on our backs. So they've moved all the units to the other end of the hospitals, away from any COVID areas. And depending on the size of the unit, they've put in a system of transfusions happen in 3 hours. So there's at the Whittington, there's 3 shifts a day. So 9 till 12, 1 till 4, and then 4 till 8. So this is every 2 weeks or 3 weeks, depending on your regime. But you have to have your blood and finished within 3 hours. So cross matches and everything else are separated from the transfusion. So you're in one part of the new unit for a cross match, and you're only letting one at a time after you've had your ear temperature taken and your hands cleaned and some questions. And if you're going for blood, that happens. The same thing happens. You go down to the bottom end of the unit and there's only 5 people at a time, all socially distanced. So that's where we are.
Thank you, Michael, very much. I think we've heard the stories of 2 countries that had disease-specific national programs on hemoglobin disorders. Therefore, they had very well organized centers for hemoglobin disorders. And I must comment also the UK consultants for actually, what's going on?
That's okay, you can talk.
But I need to see them. So, but I need to comment on the UK consultants and the National Health System that despite the many offs and the many accusations that the NHS had, the UK doctors were the first ones to actually produce guidelines for hemoglobinopathies, codify the risk levels, the shielding and everything. And I think that TIF was working very closely with your consultants, both in Italy, but also in the UK to actually help us produce all that huge response that TIF has had, and we have published considerably. So can we now hear Riyadh, please, from Canada? Riyadh is on the line?
Yes. Good morning,
Okay.
everyone from the North Americas and the South Americas.
Good morning and
good
welcome.
afternoon. Good afternoon to you, Androulla, and everyone from Europe. Happy to be here. So we'll start by looking at the slides. I don't know if you have that.
Yes.
Yes. So if we look at the map of Canada, the population is about 37.5 million. And as of May 30th, we had 90,000, a little bit slightly above that. And that's infected people here. And you see most of the infection is distributed according to the population. We have the population of Ontario, the one in the dark blue, and it's the population is about 14 million. And then Quebec, which is have about 8.5 million. That's the one where most of the infections are. We have about 50,000 plus infections in that area. Now, the distribution of thalassemia and sickle cell are also very, they really mirror the general population in Canada. So you have a lot of the patients are in Ontario and in Quebec. Plus in the other parts according to the population. So mostly in the big cities, Toronto, Montreal, Vancouver, Calgary, and so on. We have recently a smaller population starting to show up in Halifax and some other parts in smaller cities in Ontario, and that's due to the immigration of the Syrian and Afghani immigrants. So if we can go to the next slide, please. So we have about 1,200 patients with thalassemia. That's both intermediate and major in Canada. As well, we have about 5,000 sickle cell disease patients. And these are estimates because we don't have an accurate data. Now, looking at the data, at the slide we have here, the epidemic curve, you can see it started slowly, then it increased a lot in March and April, and now it started to be very up to date, and it takes about 2 weeks to show everything.
Riyadh, we are having problem with your voice, I think.
Go close to the microphone.
Depending on when the person goes to get tested.
We can't hear you.
We can't hear you, Riyadh.
Can hear you.
Riyadh.
So can we go to the next slide, please?
Okay.
That's better.
Okay. Again, and this slide shows you that, we have the epidemiology summary where I just want to point at the part at the bottom here where it tells you there's about 8,234 cases that have been hospitalized and about 1,630 in intensive care. So the numbers are fairly small related to other countries. And the death is slightly about 7,000 cases, slightly above that just recently. So to go to the next slide, please. So the impact of this epidemic has started back on March 11th. That's when we started to have announcements of the closures and the business shutdown and travel restrictions. So that triggered some anxiety and fear among the Canadian population in general. And then on March 12, we had Canadian Blood Services reaching out to patient communities, to organizations like the Thalassemia Foundation of Canada. And then they announced that there's considerable decline in the number of donors booking appointments to come and donate blood. So not long after that, patients started to raise questions, and there has been some, fear about how do I get to the hospital, risks for patients, do I go to work, do I not go to work? So there has been a lot of, anxiety with that. So on March 31st, a thalassemia major patient was denied transfusion, and that was at a regional hospital. They say it's because maybe an unannounced outbreak, but also it could be because they are trying to conserve blood and not to give blood to patients who have above 70 hemoglobin. So there is an issue of lack of expertise in that. And then on April 16, I heard from the Canadian Hemoglobinopathy group. They communicated to me that they have concerns of drug shortages, specifically
Riyadh, we don't hear you.
And another. So what I was, more concerned about is that the oncology patients do get the hydroxyurea, and they get preferential over the sickle cell and the thalassemia patients, which is unfair. And there's been a task group that's been discussing that with Health Canada and with the health authorities. Now, with respect to the ferroxamine, the shortage was mostly from the supplier, one of the suppliers who make the generic product. They have been short of product, and they have not been able to fill the gap. Could be some of it for logistical reasons, but Novartis has said they will try and fill in the gap with their brand name product. But again, they were caught off guard, so the demand was much higher than what they can provide. In terms of infections, we haven't really heard of any infections of thalassemia patients. Just till last week, I was talking to one of the nurses in Montreal, and apparently one one non-transfusion dependent thalassemia got infected, and this person has disabilities and lives in a group home, so that's probably why the infection occurred. And I've heard also from her that there was a sickle cell patient who got infected in Montreal, and both of them are doing well, and they have recovered. I've also heard about other sickle cell infection patients, I think 2 or 3 more, that I heard from social media, from their chat groups on WhatsApp, and some of them had to go through some difficult situations. Not sure if there's been any death or not. Okay, so can we go to the next slide?
We are facing problems with your voice. We don't hear you well.
Go back to what we had to do. To the next. Hello?
Yes, Riyadh. You have problem with your mic, I think.
Is it? Okay.
Yeah.
All right. Is this better?
Yes.
Yeah, sure.
Hello?
Yeah.
Yes.
Can you hear me?
Yes.
Yes. Do you hear us?
Yes, Riyadh, we can hear you.
You don't hear us. No.
Well, put back your
Can you hear me?
microphone. Now, yes.
We hear you, but you don't hear us.
Put your microphone in your ear.
Hello?
I think he took them off.
Sorry, I can't hear anything.
Okay.
Yeah.
So let's go.
Let's go to the
one.
next
Yeah.
one. Yeah.
Right. Because okay. Who is the next one? Craig Butler?
Yes.
Unfortunately, we couldn't have Riyadh completed, but we took the whole picture. Again, the numbers are very small of infected patients. We don't know, of course, the real truth, because there has to be, after the end of the epidemic, and see how many have been infected, and the antibodies, because a lot of them may have passed it symptomless, and the antibody testing will show. So let's go to Cooley's Anemia Foundation. Yes. Who is going to present?
Great.
Mr. Craig Butler?
Yes, so I'll start and go through our slides actually very quickly and then turn it over to Maria, who will talk more about the direct patient experience. I'm going to go through these slides quickly because I think that they pretty much speak for themselves. Before I start, I just want to thank Sandy Gilbert, our Senior Director of Medical Affairs, who provided the information on a couple of these slides, and just want to give you an overview. In the United States, we have a population of about 329,104,000 deaths from COVID and 1.8 million reported cases of infection.
Yeah.
Okay. On our first slide, this is just a map of where the patients that are in our CAF database are located, so you can get a general idea of the spread. This is not all of the patients with thalassemia in the United States. We estimate that there are actually between 2,000 and 3,000 patients with clinically significant thalassemia. These are the ones that have contacted the foundation to be registered with us. We can go to the next slide, please.
Okay.
This is just to give you an idea of what the breakdown is in terms of background of our patients. As you can see, it's a very, very diverse population. The largest proportion coming from the Chinese Taiwanese population, quite a significant Italian population, Southeast population, South Asian, smaller populations of Middle Eastern, Greek, African American, mixed race, and European. We can go to the next slide. These are our precautions that were taken by many of our U.S. hospitals. They mirror many of the things that we've already discussed, so I'm not going to go through them. However, I do just want to point out that these are the general precautions which many hospitals were following. Individual hospitals may have had stricter or more lenient precautions. There is not a lot of homogeneity in the U.S. between what goes on in our healthcare systems. You can go to the next slide. So we have only had 6 patients that we are aware of with thalassemia in the U.S. who have reported testing positive for COVID-19. And as far as we know, none of them have suffered serious consequences at this time. We're very pleased with this. However, I'm sure there are other patients of whom we are not aware yet. And I'm sure as things become more standardized in terms of the treatment centers reporting what's going on, that we will find out that there are more cases, but so far this is what we know of it. And one more slide before I turn things over to Maria. So again, this is pretty typical, I think, of what other people are experiencing in other parts of the world. Yes, there are problems with blood shortages in the United States, but they have not been to the extent that patients have actually been denied blood, which we are very thankful for. Some are receiving fewer units for their transfusions than is usual, therefore, of course, necessitating less time between transfusions. And there have been some reports of blood banks or hospitals who have said they will not transfuse a patient unless their hemoglobin level reaches something which is inappropriately low for thalassemia, such usually a 7, which is the standard for the hemonc patients. We have been in touch with those hospitals when we've learned about it and those blood banks and have protested this, and in the cases that we know of have brought about a change in the policy so that they understand that thalassemia patients need to be transfused at a higher hemoglobin level. And I'd like to turn things over to Maria now to talk about the actual patient experience during this time. Maria?
Thank you very much.
Greg. Thank you.
Thank you, Greg. Maria?
Maria. Impossible, Maria.
Maria, please unmute. Yeah, unmute the microphone. Maria?
Hi.
Yeah, okay.
Okay,
Hi.
so in the first week where we had the lockdown, the blood drives all stopped. The way New York Blood Center gets a huge amount of their blood supply is through blood drives in schools and college campuses. Once that shut down, about 80% of our blood drives were canceled. Then corporations were shut, and some of the bigger corporations take on a ethical responsibility in having blood drives in their headquarters. So that was shut as well. We have no other way really to gather blood. This was our main source of blood drives through schools and corporations. So New York Blood Centers saw a huge drop in this. I addressed it with my hematologist, and I'm at the hospital Weill Cornell, which is one of the thalassemia expert centers, and he has already secured all the blood for thalassemia patients and had said to us, you have nothing to worry about. There's not going to be a blood shortage for thalassemia patients in my clinic. So it made us all feel at rest. I already went about contacting my Greek army, and I had 5 Greek friends who are O positive, who are blood donors, but my hospital has policy where they don't accept direct donors. I don't understand this policy. But my hematologist said, if it gets to dire numbers, then we will accept your direct donors. But for now, we are good and secure. They had canceled a lot of the extra services at my hospital. So when we were going in for our blood transfusions, it was less patients. I'm in an oncology unit, so it was just basically the high-risk cancer patients and the thalassemia patients. And I've never seen it run so smoothly. And I hope this goes on. It was a really refreshing feeling to not have to wait 5-6 hours. I go in the morning to for type and cross, and a few hours later, I was getting my blood. So that is appointment-based. That is a really good feeling. Blood drives now are back at normal. The supply is back at normal. We have one patient I know personally who contacted COVID-19. Her name is Margarita. Her hematologist was FaceTiming with her, and her fever was at 39 for 3 weeks. And her hematologist said, when you start feeling not breathing, that's when you go to the hospital. But if it's just the fevers and the other symptoms and you're able to breathe, stay at home. She was given the hydroxychloroquine, Z-Pak combination, antivirals, and she pulled through. That was thankful. Yes. And that's it for the personal experience.
Thank you, Maria.
Thank you, Maria. Just before I go to Merulla, allow me to ask Helen, in case she has to add anything to what Riyadh has said, just to complete with Canada.
He's in Riyadh as well.
Yeah. Helen?
Yes, hi, Merulla. We had put on a good slideshow, basically demonstrating everything, advising everybody about what we're doing. The last thing we did, which was really good, was we set up a question and answer session and asked our patients within Canada to supply us with questions and anything they wanted to know about COVID-19. So they would ask the experts, and we had 2 of our hematologists from our main hospital, Toronto General, supplying the answers. So we had a good response to that, and we're happy that we were able to get information out to most of our patients. And we're in the middle of putting a transcript together, and we will be putting it on our website so people can go in and see exactly what was asked and what the answers were.
Good.
But
Thank you very much, and I hope that you have used, or the TIF's material has been useful for all of you. I hope our website and everything has been useful to you.
Which I have to say though, one thing. Thank you for TIF for putting out all this very professional, productive literature for everybody to follow. It really has given us a really calm feeling about that somebody cares enough to put things together. Thank you.
Absolutely. Thank you so much. Merulla, the floor is yours.
Yes, thank you. Thank you, Androulla, for the invitation. I just found out today that I had to present. So Put up some slides and we'll explain to you a little bit about the situation in Brazil. Roy, can you put the slides? So I want to thank Eduardo, who is our current president, that is here with us, watching this meeting, and also Denise, that she was before here. She's our manager for communication, marketing, and also data analysis. So Roy, can you show the presentation?
Uploading the presentation.
Okay.
Just a second.
Okay, and then while he is okay.
Okay.
So Brazil is a country with 210. Here we are in South America. Can you go to the next? 210 million citizens, and we had, in terms of cases, 520,000 cases of COVID in Brazil and 29,000 deaths. But we still are locked down since March 12. Our population of thalassemia, we have 382 patients, Dalmatian, 280 that take transfusion intermediate, but sickle cell, that other friends mentioned, we have more than 20,000. So in Brazil, thalassemia is not so common. I separated here to present to you, because all the situation about COVID is more or less similar to what my friends presented. I will present you some special programs that we were able to put in place for this moment to help the patients. So together with Uber, we have a collaboration for June to transport patients to their treatment center at no cost in 10 cities where the main centers are. This means that they will not need to take public transportation. And considering Brazil has most of the patients in public hospitals, this is something very important. Also, we start in the campaign and engaging celebrities to talk about the need. This is in Portuguese, but it says, you'll go out of hall only to do something well for, leave your house to do something well, something nice. It's not very well translated to English, but more or less that. And we have a collaboration with a competitor of Uber called Cabify to transport blood donors to public blood centers at no cost. In 23 cities, more or less 52 blood centers are receiving the donors. And just to have an idea how much this campaign was useful, in the first week, the data that we have, almost 800 donors went to those blood centers to donate blood. So having the transportation free was important to meet. I think we were able to get some media attention because of the campaign, and then people realized they need to donate. Next slide, please. Also, together with our communications team, we organized special content in our website so that people could understand more the details and recommendations about COVID. And one part of the website, this green part here, is a research. Tell us how your treatment is in your treatment centers so that we can monitor, what are the difficulties the patients are facing. And in social media, we promote this survey and we ask patients and health professionals to respond. So we have more half and half. Half was responses from health professionals and half responses from patients. And we see each week the situation is getting more difficult for patients in terms of canceling consultants, canceling exams, and so we can monitor and try to have some action. Next, please. Also, we did a webinar with our physicians, and special participation of my dear Dr. Fernando Tricta, that speaks Portuguese, not because he speaks Portuguese and it's easy to be understand. And then the patients could ask questions, and they could update us with what's going on in thalassemia and COVID, the studies and so on. So Eduardo is the president, the first picture, and the others are the physicians. And also next, yes, please. And also we had a collaboration with the company, because I forgot to say that all our team is working home office, and we are very busy working to try to come up with solutions, continue helping patients, and so on. And our patients' average age is about 23, 25-year-old. We have a lot of children in Brazil with thalassemia. Anyway, we have a collaboration with a company, and we can give medical and psychological support online through telemedicine. So the medical support to ask questions related to COVID, and they can online prescribe medication and also make a report that the patient can use to go in the hospital and avoid going to the hospital. Next. And to fund, you can say, how are you doing with the fundraising? Because of course the events are canceled and companies, as you know, do not donate so much, but we're very creative in fundraising. We have here auction with items donated from celebrities. So this girl here, she's a very famous basketball player. She donated her ball. Also hotels and restaurants, they donate experiences. And we have a special website for auction. And every week, new items go on for auction. It's online, nah? And so it's continuous. So you can check the items this week. Next week, we will have other items. And then each item remains like 12 days receiving the auction intentions. Also, we're doing crowdfunding, we do raffles, and these are some initiatives. Next. Now about my treatment that you asked, Androulla. As you know, 5 years already having a hard time with my extramedullary hematopoiesis, and this is giving me a little bit of trouble because more or less only 20% of my lung is free from the mass. So with 20%, I am trying to do my best. I require physiotherapy, yoga, several and special food, and doing my best to keep it up because I have many projects to implement still. But I want to say, in the beginning of the pandemic, I was in hospital for 28 days because of my lung problem. You can see me in the hospital. I was doing yoga, and in the other picture, I was doing some radiotherapy, trying to reduce the mass and keep better. Now I'm taking, what's it called? Cortisone and hydrea, cortisone and hydrea to try to reduce these masses. And also I talked to Maria. She recommended me special soup that I'm taking every day to try with the so these are my news.
Well, yeah. Thank you so much, Merulla. And first of all, as always, and despite the fact that you'll be having some personal health issues that are very important. You have managed in this COVID pandemic to produce so many innovative programs. I think that the patients in Brazil are very privileged to have you on the lead, and we are very privileged to have you with us today. And allow me to wish you all the best, go through it and complete so many things that you have to do for the patients. I would like to ask Ali to tell us a few things about Trinidad and Tobago. We know it's a very small patient population, more or less well organized. Did you have any particular interesting episodes with thalassemia on your island, Ali?
Hi, pleasant good afternoon to everybody. And I want to start off by saying thank God that at this point, none of our patients, again, as reported last time, have any reports of COVID-19 thus far. And this is on the twin island of Trinidad and Tobago. And I just wanted to start off so everybody would understand that, as Androulla said, we have a small population of 1.3 million. And of that 1.3 million is a split to East Indian descent and African descent. So we in Trinidad, of the 40 to 45% as East Indian, you find that 1 in 15 have the thalassemia trait. And in that 40 to 45 percentage of the East Indian population, is the sickle cell trait is 1 in 10, which is very interesting. And so far in Trinidad and Tobago, we have, as far as we know, split between adult and pediatric. We have about 100 beta thal patients, of which in the adult section, we have at least 10 of them that have now crossed the 30-year marker. So that is a bit interesting. And so for those who crossed the 20 marker and those who started to work, of course, COVID-19 has affected them in a different way, in that some of them, because since in the last 2 months, we've had total shutdown of our country, and therefore a lot of them have been not working at all. Some of them have not gotten any access to salaries, access to money. So this is how they are being affected in that regards. It's only recently, as of the day before, the Prime Minister announced that the country would be opening up, and it's very strangely 2 hours after a phase 3 layout of opening, and therefore allowing malls to open and businesses to open. So a lot of our patients are able to go out 2 hours after we received our first case in a month of COVID-19. So that is very interesting. With regards to the precautionary measures for our patients in Trinidad is basically the same like everyone else, but what has helped us is the fact that they have allowed in our hematology clinic at Port of Spain is only if you needed blood or if you needed urgent care, and that has given better care to our beta thal patients, and that has really helped us because they've been able to monitor it, and for those who are not in urgent need or just need a regular clinic appointment, well, you don't need to come in, and that has helped those who really needed help and really needed access to the our thalassemia patients needed access to the hematology clinics throughout Trinidad and Tobago. Is made it much easier for them, and therefore is allowed it easy access to the clinic to get blood, etc. I have with me one of our patients, beta thal Chanel Maharaj. I wanted to ask her if she would also help with the personal experience of our patients. I don't know if Chanel is with us. Chanel?
Hi.
She is here.
Yeah, Chanel?
Yes. Hi, good day. Well, I would say generally, the situation hasn't been very challenging. The only challenge that I would say that I have experienced during this time is really the availability of blood in a timely manner. And at the start of this pandemic, there have been challenges in
obtaining the required amount of blood. But like most patients, I was only able to receive 1 as opposed to 2 units in my monthly visit. However, patients were advised to start visiting the treatment center more frequently to ensure that their HB levels are maintained at the required level advised, right? And the society, together with the regional health authorities, they have been working hard to encourage persons to donate even more than before. And blood drives are being conducted during this time to increase the national blood pool. And this has been successful because I'm happy to report that in my last visit, which was actually in the past week, I received 2 pints. So I think the situation is improving slowly but surely. And with regards to accessing our medication for chelation therapy and so forth, there has been no real challenges in accessing that. The pharmacies were able to supply all our patients with the necessary needed medication. Besides this, there were no main challenges, I think, among patients in Trinidad. So we are very, very thankful for this. And of course, effort will continue to be made to increase national blood pool and encourage persons to donate, because that is what we need the most.
Okay.
Thank you, Chanel.
So, thank you very much. Can we have the screen with the people on the faces so that we can look at them, Roy? The faces. I think that I am rather concerned as to the fact that whether these numbers are actually reflecting amongst the thalassemia and sickle cell disease population. We wish and pray that these numbers do reflect the truth and that there is something scientifically related, that the COVID doesn't like the hemoglobin molecule of the patients with thalassemia in particular. On the other hand, it may be a lot symptomless or with mild symptoms in this patient population, and therefore we haven't been able to actually track down the right numbers.
But on the other hand, if they are mild, they still
on the other hand, yes, if there is mild, it means it's mild. These are the numbers we get from patients outside Europe, outside America, and I'm very impressed because despite the huge concerns that are being raised by the United States and Brazil on the news, because we are getting the news from the Euronews and everything, BBC and all that, and there is so many huge concerns as to the number of infections, the number of and the mortality rate. We think that we are very privileged to have these low numbers in our patient population. On one hand, adherence and early, precaution by the patients themselves being feared that, they are vulnerable. On the other hand, by the authorities giving priorities to vulnerable population. On the other hand, the hemoglobin molecule, maybe, the whole treatment models in these diseases. I think that there is a puzzle here that we need to put together, but this has to be put after the pandemic completes in many countries. In Cyprus, there is almost completion of the pandemic. We are finding rarely one infected patient. It's just almost zero in Cyprus amongst the community, and of course none amongst our patient population. Wow. In Italy, they're also declining, and apart from those cases that have been published, in the UK as well. So let us hope that things stay like this. So is there anything that TIF can do for you further than the material that we've already produced? Riyadh, are you on the line? I can't see your face. But
Yes, I am.
it's so unfortunate that technologically you couldn't complete your very nice presentation, but it's fine. We got we got the most important points on that. So is there anything that, because on this panel, there are 2 board members, that's Loris and Riyadh. There are 2 past board members, that's Helen and Marula and Michael. Very good collaborators like Maria, Ali, and everybody else on the line, and Craig, Thalassaemia, has been a wonderful collaborator in the last 2 to 3 years. So is there anything that you feel we can do for you more than what we've done at this point in time?
Androulla,
Yes.
I have a suggestion for us.
Yes.
We have a very nice platform for research, to research with patients. Several, from time to time we send out research so that patients can complete. But it's very interesting because when they complete, they can see their situation compared with other people that have responded before. So also it's a gain to gain for the physician, for the patient, and for the organization. And so I was going to suggest a collaborative study, putting all the organizations together. We could do the same questionnaire, and then each organization will have their own data, but comparing the data with other countries as well. And not only to check the COVID, but we can ask other questions about access and comorbidities and other diseases that they have, like diabetes. And I can organize this with Denise, which is in the line and is the manager for data research also, and send you an example, and everybody will have access, anonymous access to all the data, comparing their country with the other countries. And you can do any comparison that you want. You can filter by age, you can filter by sex, as in boys and girls, by if they do public hospital, private hospital. And so I think that once where everybody, the main organizations are online, is something that we can work together and could produce for TIFI a publication about the status. And first of all, also data.
I think it's a very good idea. Send us your sample to see, because already TIF, in the context of its commitment with World Health Organization, and Craig, please try and persuade Trump not to withdraw the funding to World Health Organization. It's very important to keep funding. So please, you're there, you're in the United States, take Maria with you and go to Trump. Please help World Health Organization stand on its feet, because in this pandemic, I think the leader has been World Health Organization, and all the countries have been following the World Health Organization recommendations. Polio and all these have disappeared because of World Health Organization. Sometimes it doesn't do it at the level it should. We're aware, but let's keep it and let's strengthen it. But Marula, to your suggestion, we are very much in a positive mood. So let us have your questionnaire, and then we'll come back to you with concrete. We want to do that. We want to collide information.
Okay. Yeah. And Androulla, China will help OMS, the World Health Organization.
China will help. Okay. What do you think, Michael?
Yeah, okay. I think America's got bigger problems than that. With Marula's suggestion, you're going to have a bit of a problem, because you're going to face data protection laws in Europe that are different from say data protection laws in Brazil or in the US or whatever. So that may not get through. You may not get buy-in into that. But TIF is in a good position for something slightly different. You can ask the clinicians in every country to give you the information on the thalassemics with COVID, mortality rate with COVID for thalassemics, and ones that have had it and recovered. And you can get that data without names or anything like that. And you should be able to pull a study from that to see if there is a pattern, if thalassemics are more susceptible, if the shielding has worked, and various other bits and pieces. So you can cut and slice the data as you need. And I think TIF is in the ideal position to get that from the clinicians, whereas the countries, societies may not get all that information or be able to build a proper worldwide picture.
Yeah, we are doing that actually. We are doing that. Although I have to share with you that it's amazing the fact that India, a complete subcontinent, has reported no cases. And I'm afraid that we are trying very hard from the beginning of the pandemic and even before, because as Merula said, with or without the pandemic of COVID, we need to collect data on the globality of the comorbidities and what is happening across.
Yeah.
But now, India as a subcontinent with no reporting, I'm very worried on the time.
Yeah, but Androulla, you know that certain countries are not going to report accurately for one reason or another.
Yes.
Right? Either they don't want to show it as a problem, or politically there's other reasons why they don't want to show it. So you know, but if you can plot what the general global transmission rate is, you should be able to say, oh, and as an approximation, there should be 100,000, 200,000, 300,000, infected. You're not going to know how many passed or how many were, or anything like that. But you'll be able to say that in 1 billion people, even at 1%, you're going to have 100 million or 200 million or whatever that should have been infected that haven't been reported.
Yeah, we need extrapolation, yes. And it's good that some European countries like the UK do have numbers, and Italy and Cyprus and across, because then we can use them for extrapolation. Yeah.
Androulla. Sorry, Androulla. Yeah,
sorry, I have to say bye because
bye. Bye. Very happy to see you, Merula.
Thank you. Sorry.
Bye, Merula.
I cannot stay longer.
Bye.
Take care, Merula.
Yes, bye-bye.
Come back to us. Come back to us with your questionnaire, okay?
It's nice to see everybody here. I miss you all.
Thank you. Wish you the best.
Take care, Merula.
Bye-bye.
Take care.
Bye.
I have to say that since the beginning of this pandemic, we tried in Italy to drain information from our doctors, and they have been quite reluctant to provide numbers and to provide information about the patients. So I don't know if we, and I mean we as TIF are in the position to create a sort of, I don't know, a panel of experts, 2-3 experts, no more, and asking to our expert to, in a sort of interaction with other clinicians across the globe, for drain this kind of information, because I'm quite afraid that many of these patients or many of these clinicians are not keen to provide data or provide information. So this is my experience, Michael. I don't know if...
Oh yes, no, it's true. And as Michael said, a lot of countries think that it's damaging the picture of the Ministry of Health. If you report.
That's why I think it has to come from TIF. I think it has to come from TIF, because The advantage of the international federation is it will work at a different level to the local associations.
Yeah.
So whereas we ask our clinicians and so on, they'll say maybe, or you can't get the information from this doctor or that doctor. Whereas TIF as an association under the World Health or the AMRO or anything else will be able to have a better chance of getting that information.
You all involved. From me, thank you very much, Michael.
I was actually going to say, Michael, that we've already made attempts.
Yeah.
We started off with a very detailed clinical questionnaire, which ran into the personal data
2 months
issue. We've tried to collect aggregate data. We're getting trickles of information. And even on aggregate data, how many patients are infected, how many deaths did you have, etc. Even that, some doctors keep telling us, oh, I've got to get permission from so-and-so, and are reluctant to give. I do not know why, because it's extremely important. In the United States, there's been an excellent registry of COVID-19 among sickle cell patients.
Not thalassemia.
And we know exactly the clinical aspect of sickle cell, how many patients, etc., are in the United States and what they had and what they didn't have. Unfortunately, for the rest of the world,
but we are working. We are working. We connected with India, Kingdom of Saudi, South China,
Turkey,
the whole of Europe. We are working now.
Can I just say, I think that the reason that you're going to have, you're going to find it difficult to get this information is because governments and mainly governments feel that once history is written, that people are going to turn around and go, you were too late here, you were bad here, you were doing this, and they'll be beaten with it for the next elections and all the rest of it. So even now, you know, how the British government reports some of the results has totally changed from the beginning. So at the beginning of they were reporting that, oh yeah, the UK is doing better than everybody. But then when the UK matched Italy's rate and overtook Italy's rate, all of a sudden that slide of we're better than everybody has disappeared. And they don't show that anymore. So they've stopped saying we're better or worse because they know that they're going to get beaten over the head with it. So that I think is why.
No, but it's good we have countries like UK because we can rely on the registries. You've got a national registry, you've got treatment centers, you've got consultants that cannot but tell the truth. You've got a national health system with all the odds, but you know, the reports there are there. Therefore, we very much rely on such information from these countries. Okay, so is there anyone else? Frank, do you have to add anything before we thank you and close up this meeting?
Androulla, I have concerns about the impact of this coronavirus on healthcare systems. And I think TIF has to work with the organizations in the developing countries and even in the well-resourced countries to keep reminding authorities that you don't forget about the treatment for these patients because of the new expenses and the new burden that's added on the healthcare system. That we can't stop.
Of course. Riyad, you have raised a very important point. We've already made a global appeal that national health systems should continue to have uninterrupted care for these patients. And you know that most of the healthcare systems across the world outside Europe are in a very big transition stage in becoming universal coverage. And this is what we are aiming at, and we are promoting and, raising a voice, because unless this system become universal coverage healthcare systems, as we have in Europe, as we have in NHS, these chronic diseases will never get their fair care.
Yeah.
And I come to the United States, that you'll also find, although the most developed country of the world, and the planet is looking up to your science and to your research in the United States, you have one of the healthcare systems that, most of us don't wish to have. And therefore, you need to also fight for universal coverage. I don't understand such part of the world where we're all looking for, in terms of research and a CDC that leads the world, and research activity that leads the world, has the patients under such a healthcare system. So with all this, thank you very much for all your contribution, for all your collaboration throughout this. Let's stay united. We'll come up with some more ideas after this panel, and let's keep in close contact. Thank you. Thank you very much.
Thank you. Thank you, everyone.
Nice morning.
Good to see everybody.
Thank you.
Bye.
Bye, everyone.
Be safe.
Bye-bye.